Assalamualaikum and very good morning to all who are watching us right now. I am Mr. Amir Rafiq as a moderator for this today discussion with the great invited panelists. I would like to discuss the pandemic that happened around the world right now and hit Malaysia too. This current pandemic has almost completely changed our daily life where now we are at critical level as almost every day there are COVID-19. Case report and this situation has worried many parties. Before I kickstart this question, I would like to introduce our panelists first. Our first panel, who is Safety and Health Officer, Ms. Nur Hidayat. The second one, Ms. Nurul Atika, the manager of Eversendai Group. And the last one, Mr. Ali Insan, who is the project coordinator. Our discussion today is related on consideration for public health and social at the workplace in the context of COVID-19. Okay, let's start with Ms. Nur Hidayat first. Ms. Nur Hidayat, how can people assess the risk exposure to COVID-19 at the workplace, and what is the plan for preventing or measures taken to overcome this issue?
First of all, thanks for inviting me to this interesting discussion. For these cases, there are three exposure to COVID-19, which is low exposure risk, medium exposure risk, and high exposure risk. I will briefing you what are these exposure risks actually. For low exposure risk, jobs or works without frequent, close contact with the general public or others. Workers in this group have contact with the general public with the others. It means that this group have minimal occupational contact with the public and other workers. For example, some jobs may include remote workers like working from home, office workers without frequent close contact with others. Second, medium exposure risk. Job or task with the close frequent contact with general public others. This risk level may apply to workers who have frequent and close contact with people in high population density work environments like bus stations, public transport, markets, and other activities where physical distancing at least 1 meter may be difficult to observe. For example of such jobs may include home deliveries, construction security, and so on. The last one is high exposure risk, where jobs or tasks with close contact with people who may be more likely to have COVID-19, as well as contact with objects and surfaces possibly contaminated with the virus. For example, transporting people known or suspended to have COVID-19 without separation between drivers and the passengers, providing domestic services or home care for the people for COVID-19 at the time of their death. Jobs that may fall under this category, such as domestic workers, social care workers, personal transport, home repair technician who have provided services in the homes of people with COVID-19.
That's such a good explanation for Ms. Nur Hidayat on how can people assess the risk for exposure. Let's move on to our next panel, Eversendai Group, Ms. Nur Atika Mira. As a manager and employer, you should carry out and regularly update the risk assessment for work-related exposure to COVID-19, preferably with the support of occupational health service as employer. How you should ensure that workplace plan for the prevention and mitigation of COVID-19.
As manager, I will ensure that workplaces should develop an action plan to prevent and mitigate COVID-19 as part of the business continuity plan and according to the result of the risk assessment, the action plan and preventive measures should be regularly monitored and updated. The workers and their representatives should be consulted and participate in the development, monitoring, and keep updating of the workplace. It is very important to monitor the effectiveness of the preventive measure and compliance of workers, visitors, customers, and clients with measure.
That such a nice sharing. How about the measures should be taken at the workplace and job at high risk?
Thank you, Mr. Amirul, for the question. As a manager, when our workers exposed at high-risk workplaces, I will ensure that they assess the possibility of suspending the activities, enhance regular hand hygiene. Company will provide medical masks, gloves, and eye protection for workers who must in the home of people who are suspended or known to have COVID-19. Next, train workers in infection prevention and control practices and use of personal protective equipment. Avoid assigning tasks with high risk to workers who have pre-existing medical condition, are pregnant, or older than 60 years of age.
Thank you, Miss Atika, for the good explanation. And I think that was a great effort from you as a measure to ensure the safety and health of your workers. Back to Miss Hidayat, from your perspective, is a mental health and psychosocial support should be provided to workers during COVID-19?
Yes, it should. COVID-19 is associated with a range of concerns such as fear of falling ill and dying, of being socially excluded, places in quarantine, or losing a livelihood. Symptoms of anxiety and depression are common reactions for people in the context of COVID-19. Mental health and psychosocial support should be made available to all workers, and comprehensive risk assessment can help identify and mitigate related occupational hazards for mental health.
Thank you, Ms. Nur Hidayat, for your sharing with us. Let's us move to our last panel, Mr. Adil. Every worker have to play their roles when it comes to work. So it's just a simple question from me. What are the rights, duty, and responsibility of worker when they are entering the construction site?
Thank you, Mr. Amirul, for the question. Of course, yes. Every workers need play their role when they are entering the site. Workers are responsible to follow the measures for occupational safety and health and infection prevention and control established for their workplace, and to participate in training provided by the employer. Workers should report to their supervisor any situation which may present an imminent and serious danger to their life or health. Workers have to right to remove themselves from any situation that they have reasonable justification to believe presents an imminent and serious danger to their life or health, and should be protected from any undue consequences as a result of exercising this right.
I see you as a project coordinator. You are exposed to an open environment where you are responsible to monitor every movement of worker on the work site. So, what should be taken into consideration when setting a physical distance at the site?
As project coordinator, I must monitor and supervise all the place environment, including people who are inside construction, especially the workers. As all we know, Ministry of Health has issued a number of measures to prevent COVID-19 from spreading. As I guess, keeping a physical distance at least 1 meter between each person in all settings, including at the workplace. because transmission can occur in crowded places. If you want to greet people, greet without physical contact. Encourage workers to avoid handshakes and hugs while greeting and interacting with other workers. I also implement a no visitor policy. Allow only authorized workers into the site during work hour. If physical distancing measures in the workplace are not feasible for specific tasks, consider whether the work can be suspended, and if is not possible, apply additional protective measures such as screening the temperature, wear face masks, enhance hand hygiene or sanitizer, and other related preventive. If physical distancing alone cannot prevent COVID-19 transmission, so it is our responsible to keep applying physical distance. So that's all from me, and I just want to say let's fight against COVID-19 together, and remember, to stay positive is to stay negative. Thank you.
Thank you, Mr. Adil, for your explanation. I think our discussion come to the end, and our panelists gave us the best sharing and opinion on our topic today. I would like to thank all the invited panel for spending their time with us today. I hope you that we practice all the precaution in during COVID-19, and together we fight against COVID-19. Thank you. Thank you for your time.